Thanks for tuning in to Loretta Live. I am back with Georgina Maldonado, formerly of Genesis Consulting. She's been looking at the impact the Affordable Care Act is going to have on our small business community. Georgina, thanks for staying with us.
No problem. Thank you for having me back again.
Okay, so we know that President Obama has said that most large businesses, I believe the number is something like 97% of them, actually already have health care plans in place.
Correct.
But he has also said that that he is going to allow them another year to get ready to ensure that they all have plans in place. But then you have your small business owners. Now, small businesses can be myself, just as a consultant, for example. I own a small business. It could be 4 people. It could be 16 people if I'm a franchisee for a 7-Eleven, for example. A small business can also be up to 50 people under the Affordable Care Act. So tell me, what will the small business people be able to do under the new law?
Well, the small business owner, there's a lot of confusion. They need resources. They need places to go to and obtain this information. But it's a huge opportunity for them because they will be able to ensure their employees and keep the employees that they truly value, that makes their business thrive.
Right. In fact, one of the problems that I've heard from small businesses before is that they would like to offer health care packages to their employees, but it's been so expensive. They don't have the ability to spread that out over many employees, especially if you've had somebody, for example, who's had a pre-existing condition and therefore can't even get health care through them. So this really will be an opportunity for them to be able to go out and to purchase. Right now they try to purchase it on the open market. It's just too expensive. But isn't there going to be another exchange, another marketplace, if you will, just for the small business owner?
Correct. Through Covered California, they developed this additional coverage plan directly targeting the small business owner, and it is called SHOP. As of right now, they haven't quite finalized the health plans that are going to be part of SHOP. However, the business owners need to stay in communication with any type of resource that is out there through a Chamber of Commerce. One of the prime examples, the Santa Ana Chamber of Commerce in here in our local area is working with an insurance agent to educate their membership with the changes with the Affordable Care Act and the SHOP option.
Right. So under the Affordable Care Act, you have the individual exchange, Covered California. That's where you go if you're an individual and you want to buy for you or your family. If you're not with a large business that's offering it, or if the small business isn't offering it, or if you think it's too expensive and you can do better in the individual marketplace. And if you're a small business owner, up to 50 people, you can go into the SHOP and look at those plans and try to buy one of those plans for your employees.
That is correct.
But you're not required. Up to 50 people, you're not required to, and you won't pay a penalty.
No, you won't.
After 51 people, you will pay a penalty as a small business owner. But all the way up to 50, you actually, if you don't want to, you don't even have to go to SHOP. You can just tell your employees, all of you are going to go and get it out of Covered California and get an individual plan.
Yes, correct.
So that's, I wanted to clarify that because there have been so many small business owners who have so many questions from me. They're worried to death. I'm like, wait, slow down a minute. The only positive thing you have to worry about is that because of this new law, you will actually be able to go into a place, into a marketplace, and probably find more affordable health care for your employees.
Yes.
And if you're under 50 people and you don't even want to make that effort, everybody goes over to the individual plan and they find what they want, and you're not on the hook for anything as a small business owner.
No, however, also as a small business owner, you will be able to get subsidies to offset the cost of providing health coverage for your employees.
That's one of the reasons why you might want to go and look at SHOP.
Yes, and so if most business owners, I recommend for them to visit the site of Covered California and really look into the shop option and get information so that when open enrollment does come around, you make an educated decision for yourself as an owner and also for your employees, because as you know, providing health insurance also creates loyalty.
Of course,
to a
having
business.
benefits is very,
Exactly.
very important. Well, thank you, Georgina, for helping us to understand the Affordable Care Act, especially the way it applies to the small business. And so now I want to do what we call myth busting. There's so much misinformation out there. So I'm going to say a myth, and you
Sure.
tell me whether it's true or false, and explain it just a little bit, if you will. Okay, so the Affordable Care Act will bust our budget.
That is false. Because with everyone having health insurance coverage, it will actually benefit the cost.
Okay, how about the Affordable Care Act hurts Medicare and seniors?
No, it doesn't hurt Medicare or seniors, because with all of the additional preventative services that will be at no cost, preventative care is key to any long-term illness. So no, it's actually a great benefit.
And actually the donut hole closes also on the
Yes.
drug benefit for seniors on that. Okay, what about the Affordable Care Act will increase premiums?
No, actually, according to the Congressional Budget Office, it decreases them by more than 59%.
Wow. So if we would have done nothing, they would have kept going up. And
Yes.
actually, just like we saw in New York last week and in California in June, where the amounts in each of those marketplaces, we saw that the price actually came down quite a bit. It was much lower for Californians than we even thought it would be. So that's really great. How about the Affordable Care Act is taking away our freedoms?
No, it is not. It is actually giving us more options to be healthy and be able to go to work and have a healthy lifestyle.
Right, because before, if I did have health insurance, but I had a pre-existing condition, I was actually tied to that job. I couldn't leave it because, you know, I wouldn't be covered somewhere else. And so now that I don't have to worry about pre-existing conditions starting in January 2014, I can actually leave a job that I might have left a long time ago and gone and done something else, right?
Correct.
So I actually have more personal freedom.
Correct.
Great. How about the Affordable Care Act will come between me and my doctor?
No, actually, you continue to build a relationship with your doctor, and it turns into quality of care. You'll develop that relationship not only with the doctor but the staff, because they're the ones that call you to schedule the appointment for any follow-ups, any lab work that you may have done. So it works.
And under the Affordable Care Act, instead of paying for each procedure that you get done, now we're going to have a different way of looking at health care. The doctor's actually going to be responsible with you. You're also going to have some personal responsibility to work together to make you healthier. In other words, the way the insurance will work is the doctor will actually make more money if you are a healthy patient.
That is correct, because you want accountability from your doctor as well. You're accountable for your own health, but the doctor is out to help you and guide the way to make choices for your family and yourself.
Great. And the other thing that I know is when the doctor is seeing you every year on an annual basis, because now it doesn't cost any office visit dollars. It doesn't cost anything to have your mammogram, to have your pap smear. You know, a lot of women skip it. You know, they maybe go once every 3 years, or maybe they just go when they're sick or they're not feeling exactly good because maybe they don't have the $25 office visit and the $50 copay or what
That
have
happens
you.
quite often.
Now that preventive care is all free at least once a year with a physical, you'll actually see your doctor more often than you normally would.
And you develop the relationship with him or her.
That's really great. Well, Georgina, I really want to thank you for coming today and for explaining a little bit about what's going on with this new law. Well, that's going to do it for this edition of Loretta Live. Please be sure to log on to coveredcalifornia.com for more information about the Affordable Care Act. And please don't hesitate to contact my office in Garden Grove. The number there is 714-621-0102. I want to continue to hear from you and work hard to address your needs. Thank you for tuning in. And until next time,